vaccinated. We are still doing our investigations and interviews with him, but we believe he is a close contact or a contact from the Captain Jack's fish and chips shop from last Monday. This is another reminder of how important it is to check the exposure sites, because you can absolutely catch COVID at an exposure site. The virus in Katherine has not just been transmitted within households, it's been transmitted in the community. It's also a reminder that this virus can take a while to incubate for some people. So just because you test negative the first time doesn't mean you won't be negative the second or third time. From our early investigations, we know this gentleman has some close contacts through his work. We expect there to be more. There were 2,350 tests processed in the territory in the 24 hours to midnight last night. This includes 1,149 tests in Katherine. We did 31 more tests in Wastewater Camp, and we are confident all residents in Wastewater Camp have now been tested. We are also confident that all eligible residents in Rockhole and Wastewater Camp and Binjari, I believe, I'll triple check this, but I'm very confident all eligible residents in Rockhole, Wastewater Camp and Binjari have now received their first dose of the vaccine. All of the first test results from Rockhole have come back negative so far. We're doing the day 5 testing in Binjari today. Given we know people can become positive after an initial negative test, we expect more positives out of this testing, and it shows why the hard lockdown there is so critical. The Bicentennial Road catchment area continues to return positive wastewater results, and the Katherine Golf Course catchment has returned a positive wastewater result from Saturday sample. This indicates there continues to be positive cases in Katherine that are yet to be detected. Testing continues to be crucial. Please keep getting tested. The close contact numbers now stand at 460. 453 are located and isolated. These contacts have returned 406 negative results so far. 2 exposure sites. 1 more close contact site has been added overnight. It's the east side mini mart on Monday morning the 15th between 8:05 a.m. and 8:15 a.m. There have been 14 casual contact sites added overnight. They are spread across Katherine and across last week. Please check the website to see if they apply to you. The Woolworths has now been listed as a casual exposure site 7 times. And I know this had an impact on their ability to staff the store. They've had to adjust their opening hours regularly during the lockdown. I thank the Woolies crew in Katherine for the incredible work they are doing to keep locals supplied, and I thank them for their cooperation with testing. We recognise their importance to the community, as well as a number of other workplaces like childcare centres. These are critical services during outbreaks and lockdowns. We are now working with Woolies and other essential services on a testing protocol that allows them to continue to operate even while they are being listed as exposure sites. This is the same approach we take with our healthcare centres. We know we need our supermarkets open, we need our childcare centres open, they will stay open. And of course, all the people who provide care and support during these difficult times, like our healthcare workers and police officers, you have been brilliant. One group I haven't mentioned before is the Territory Families Welfare Group. When there is an outbreak like this, providing care is about more than healthcare. Our welfare teams are going above and beyond in Katherine, Binjari and Rockhole. They've been carrying a very heavy workload, making sure residents have food and essential goods. They have the right mental health support. So is the Chief Minister and Cabinet's regional team in Katherine, working all day, every day in full PPE gear. We also have a stack of NGOs working in Katherine and Robinson River, particularly supporting our homeless communities. I want you to know we appreciate what you are doing. All Territorians appreciate what you are doing. Thank you. The patience and resilience of Katherine residents and surrounding communities these past few weeks has been outstanding. At this stage, Katherine will have to be in some form of lockdown or lockout until the 4th of December to the end of next week. That doesn't mean the whole period will be a lockdown. We will transition to a lockout at some point. I cannot give you any more comfort on when that will be yet. I know this feels a bit never-ending, but every day we know more. With every test, we know more. So keep doing what you are doing, and we will get there.
Thank you, Chief Minister. Thank you. I'm just going to say a little bit about the 3 new cases and their relevance and about their condition. So all 3 are connected with our cluster. One is a child who is the son of someone from Robinson River and was in quarantine. That child is stable at the moment. The young woman who presented overnight, in her 20s, she is still in CNR. She does have significant respiratory symptoms, but she's not requiring hospitalisation at this stage. And then the man in his 40s, who's partially vaccinated, had one dose. He was already there, but he was tested twice negative and turned positive after becoming symptomatic yesterday. So I think this is important to note, that people can test negative a number of times before they turn positive. We will expect to see that happening, particularly in Binjari and other parts of Katherine. The other thing to point out is that wastewater, as the Chief has said, wastewater has remained positive in Bicentennial area and also now has turned positive in the golf course area. You will recall that we have had a number of positives in the golf course area as well in the past. That means that we have had to focus our efforts, particularly in the Bicentennial area, and there is, as the Chief has said, door-to-door work going on to identify cases by testing, and also to increase our vaccination rates in Katherine. Thank you. That's all I want to say.
Good morning. Things have travelled pretty well for us overnight, particularly in the Katherine, Binjari and Rockhole localities. Of note, we'll continue to have our presence there. It's been spoken about. Our fifth day testing is commencing through Binjari today. I've spoken to the sergeants who are both on the ground at the forward command post for both Binjari and Rockhole today. Their advice is, through the course of the last days, they've been visiting frequently to the households, making communication with the households. Again, the flow of communication seems to be working quite well. If anybody's feeling that they can't get the communication out, please make sure you do sing out to those people when they're walking through the community. They are there to help you, and they're very keen to do so. The general advice from them, though, is everyone's being really compliant, understanding of the situation, and that's working quite well. So again, my thanks to everyone involved in that. Given the Chief's just spoken about the lockdown potentially being in place for a while in Katherine, we are aware that there are some residents, bona fide residents, permanent residents of Darwin and Alice Springs that may have been caught in Katherine that are not bona fide essential workers. We are looking at a model of whether we are going to be able to facilitate your return to home, where you may go into 7 days quarantine arrangement, similar to our home quarantine arrangement. So we may be able to give you some further information on that tomorrow, but what I would urge you to do, if you are in that category, and I stress you must be a permanent bona fide resident of either Alice Springs or Darwin, to go and get a test today, so that you may have a negative test that will assist us in potentially making that movement happen. So I just foreshadow we are working on that. We're cognizant that there are a few people caught up in that space, and we don't want you to be caught up there longer term unnecessarily. The broader work that continues, we've had the Australian Defence Force mobilised. There's been meetings this morning, so again, we're very appreciative of that support. That will certainly make our ability to respond more broadly to ensuring that people are compliant within the Katherine area more important. It is unfortunate that we have these consistent wastewater tests coming through, but that does give an indication that we still need to trace where this positive is coming from, and we need that support of the community that has been so fantastic to date. So we appreciate it's frustrating, but it really will get us closer to that freedom that we know you all desire. In Darwin, I've just got to make a point. We unfortunately had an incident at Coolalingga Vaccination Centre this morning. A gentleman that appeared there indicating that he was not overly happy with the process. That caused a bit of a disturbance. Unfortunately, pushed one of the hands away of one of our staff there, one of our health staff, and grabbed the needle and injected himself with the vaccine. That's not appropriate behaviour. That's not behaviour that we should tolerate. He's been issued an infringement notice for disorderly behaviour. Again, our vaccination staff are there to help you. They shouldn't be subjected to that type of behaviour. It just cannot be tolerated. So we understand that it can be a frustrating time for people, but they're not the people to vent your frustration, indeed understand that it's a purpose here to try and help the Northern Territory. Thank you.
Commissioner, just with that incident, is the nurse receiving any sort of medical treatment?
No injury was sustained, as I understand it. As I say, it was more a case, as I'm briefed, of brushing the hand away to get access to the needle and then self-inject, or apparently self-inject. So, of course, herein lies the confusion. They've got to be able to satisfy themselves that he ultimately has received the vaccination. So that's a curiosity they'll work through.
Has he been arrested?
No, he left the facility. We've obviously tracked him down since there. Unfortunately, it appears his partner returned there and wanted to vent her frustration as well to the process, probably only getting one side of the story. But again, just disappointing and not what the staff need given the enormous efforts they're undertaking on behalf of the Territory.
So there was a follow-up incident. So this man's gone and decided to supposedly administer his own vaccine, and then a partner or someone known to him has come back to that vaccine centre and given another spray to health workers.
That's the understanding I've got so far.
How's the lockdown compliance been in Katherine? Have you seen an increase in domestic violence?
We continue to monitor that. Unfortunately, our domestic violence rates have been too high for far too long. I'm not being briefed that we received an increase on what are probably already intolerable high levels, to be quite upfront. But again, we know that the movement has mitigated quite considerably. The streets are relatively peaceful, which is encouraging. But of course, we want to make sure that anyone who is potentially a victim or being subjected to family and domestic violence knows that they can leave. They don't have to stay in lockdown for those environments. They can leave and get our attention, and we'll swing in and support them.
Chief Minister, what's your understanding of the residents of Binjari and Rockhole and how they feel about the harder lockdown measures that have been introduced?
We've had really good cooperation. I understand we're having lots of conversations. People understand what's happened and why. And we've got a lot of welfare teams on the ground, as well as obviously healthcare professionals and others. So all the feedback I've had up through SEMPSI is rouse where we expected. I mean, obviously they're in hard lockdown because there's been cases. People they know are not well, but people understand why the hard lockdown's there, why we're doing what we're doing, and that everyone's getting the best care that we can possibly give.
You say that most people in Binjari, Rockhole and Walpuri camp have now received their first dose. Does that mean most of the people in those communities in that camp were completely unvaccinated at the beginning of this?
All I can say is that they were below 70% first dose when we went in to respond. Our advice now, having gone door to door, talked to everybody in all 3 locations individually around what their vaccination status is, checking that against the Australian Immunisation Register and our PCAS database, and then confirming their vaccination status or administering the vaccine. We now believe it's 100% first dose in all 3 communities.
What does that mean in terms of cutting transmission and sort of the situation on the ground in Rockhole?
Well, the Doherty modelling shows that if you can do something along those lines, you halve potential hospitalisation. So obviously you prefer to vaccinate people in advance, but a reactive vaccine response is critical to reducing hospitalisations and that demand. So we've done everything we can. I thank everyone in those communities for putting their hand up to be vaccinated. And obviously I get it. There's literally a case in your community and you see it, that can take care of what we now see is probably more of a complacency issue than a refusal issue.
How many have more close contacts been flown into Howard Springs in the past 24 hours?
Yes.
So do you know?
So as of this morning, 216 close contacts are now being housed in the Centre for National Resilience. As indicated yesterday, we mobilised a much larger aircraft to move a bulk of the people who are close contacts, particularly from the Binjari community, but obviously a handful as well from Katherine.
Do you have an idea of how many of those 216 are from Binjari, Rockhole versus Katherine? I suppose some would still also be from Robinson River.
Yeah, so it was in the high 30s for the number from Binjari from memory, and the remainder were from Katherine.
And is your plan to bring in all of the close contacts whenever there's an outbreak in a remote community?
Not all. Some will have the ability to be able to self-isolate, but CDC do that on a case-by-case basis and satisfy themselves through coordination with us that location is suitable, and we then move into the compliance element required for those individuals. However, as stated, wherever we've got those places, such as overcrowding, or where it's just simply not a case where an individual can have access to their own ablutions, for example, that there's no share obligation for those. It does create a limited pool for those that will be able to quarantine without going to the Centre for National Resilience.
And given the changes that we've seen from Monday to the border entry rules, so are there any domestic arrivals, international arrivals now going into Howard Springs, or is it just being used now for close contacts?
No, and any unvaccinated, as has been indicated, but all those others that are coming through, we've clearly had some that unfortunately haven't been able to get the PCR test required in advance of arriving in 72 hours, so they have to go into the CNR, and once they get their negative PCR test, they'll be able to go into the home quarantine arrangement.
I was under the impression if you're unvaccinated as of Monday, you couldn't come to the Northern Territory at all. You can come, you just have to go into Howard Springs.
Returning residents.
And just to clarify as well, you mentioned about people who are struggling with facilities. Yesterday you mentioned that people who didn't have power tokens, they would be assured no power outages. The ABC understands there's been a number of homes without power. Another instance where there was an elder who was, their home was without power, a family member, they were advised by their GP that a family member could drop something to a police turn-off, supplies and stuff like that. The police would then transport it further on. When that family came to the police turn-off, they say they were, told if they don't leave immediately, they're going to face fines and other punishments. What's going on there?
I've heard some of those rumours this morning. I've actually received information myself via text message from people who are indicating that. I'll forward that directly on to our teams who've been in touch with the forward command post. I think there's a bit of a mixed message in the stories going both ways. As it relates to the power, we know that there's been some houses that have struggled with some power supply. We're not sure that that's necessarily linked to tokens, might be a broader issue, but Power Water are working on those things at the moment. But again, what it points to is that people are raising that information. The teams are highly visible on the ground. I continue to urge everyone to do it. What we've got to be cognizant of, though, is it's a bit simple to just say, come and drop it off at the border checkpoint and the police will be able to go and drop it off to a house when we may already be dealing with a number of issues, and certainly our key role at the moment is to minimise movement from that facility. So there's got to be a little bit of give and take in what we're trying to do, and a level of understanding that we'll try and make people as comfortable as we can, but it might not always be at the time that they want it to be.
You mentioned give and take there. Residents are giving a lot here. They are complying with a lockdown that we've never seen before anywhere in the Northern Territory. It's sometimes in houses without air conditioning, under a degree of heat stress. They might not be a close contact and therefore not be able to get transported to Howard Springs. Surely the incumbency here is to make sure that more is done in those instances to make sure they're looked after and have power.
Well, I can tell you categorically that the exceptional work of the Frontline on the ground is nothing but full of support for the people of Binjari. There is a critical consciousness of the impact that this is having. Our people are working in 40+ degree heat with not an awful lot of respite, with not an awful lot of stand down. They're not whinging, they're not complaining, they're putting their community first. The large proportion of the Binjari community are working in accordance with that. Unfortunately, and 6 of them received infringement notices, didn't. So you can be very assured that the efforts are very focused on trying to make sure that everybody is as comfortable as can be reasonably possible. We are moving people to the Centre for National Resilience that are close contacts. We've had another positive link to Binjari last night. That's likely to see even more people being moved, and that is the model we will continue so that we can get the Binjari community and Rockhole community and Katherine community out of these arrangements sooner rather than later.
With regards to the ADF dropping supplies, are they dropping supplies to people just in Binjari and Rockhole, or are they, because of the situation with the Woolworths, also doing drops to other parts of Katherine?
They're tasked specifically to certain locations to do what they need to do and what the purpose of those roles are. Obviously, we are conscious that we don't want to cross-contaminate through any failure of PPE wearing and the like by any of our people on the front line who are engaging with these communities. I think you've already seen the imagery that shows the type of PPE that is being worn by Frontline, Health, Police and the others out there trying to provide support. It is full face masks, it is the gowns, it is a high level of PPE. So we've got to make sure that we confine them to those localities so that we're not ourselves going to contribute to a potential spreading incident.
Do we know how many packages they've dropped off in those 2 communities so far?
No, what I do know is there was sufficient for 72 hours initially from the weekend, and we've surged that even continuing and making sure that fresh food is part of that supply chain.
A question for the Acting Chief Health Officer. I'm wondering, this clearly concern about positive wastewater samples at 2 locations now, and the idea that there are cases within the community not yet detected. Is there a likelihood of an explosion in cases or significant uptake if we have those people who are in the community, potentially while infectious too, that we're going to see a day where there's more cases than we've seen before?
That's the reason why we're maintaining the position of lockdown and probably lockout at some point. So at the moment, it's well contained. And that's why we put this enormous effort now into tracing those cases. There are very likely to be further cases. Probably not a great many, but we only need one for it to spread again. So that's why we're being so cautious at this point. We do not want to send Katherine back into lockdown again. It's much better to deal with it now, when there's a small number of cases, track those down and eliminate it. Wastewater has been extremely helpful to us in identifying those areas of risk. We will continue to monitor that daily. We actually can see the signal strength of the wastewater. It tells us whether there is decline, and we are seeing a decline. But there's no ratio in which you can say how many cases there are, depending on what the signal strength is. But it is likely there are 1 or 2 or perhaps a few more cases in either of those catchments.
A question on the docketing modelling.
How did you land on the December 4 date?
So we usually have a replication cycle approach to this, so that's usually 14 days.
On the Doherty modelling, obviously we've spoken and heard about 30 to 100 cases per day is really what our hospital system could manage. I'm wondering how many hospitalisations a day we could manage, because this current outbreak, 40 cases, 5 are in hospital, that's 1/8 of cases already infected in hospital. Can we sustain that over a period if we were to open up?
Yes, I mean, this is clearly the major concern. We've been preparing for a long time for numbers. The numbers we can sustain, obviously we've got a number of hospitals in the territory, so it's not just the Royal Darwin Hospital where we would be managing those patients, and there'd be a variety of degrees of severity of patients as well. So we well planned for that. The numbers that Doherty says we can sustain, or the numbers that we are expecting with the levels of vaccination that we're aiming for, set against our existing capacity, suggests that when we get to that vaccination level of 80%, we can sustain that in the health system. That will clearly be difficult. What we really do, and I suppose this is an opportunity, we really do want to get beyond that 80%, and we can. What's very obvious, and it's very important to note this, with Rockhole and Binjari, they have clearly been low vaccination levels. We can't say exactly, but the numbers, as has been implied by the question before, the numbers of people that had received a first vaccination in this outbreak is very large as a proportion of the population. If we can achieve that across the territory, clearly people will get vaccinated if they feel threatened. So the message is, you are threatened. This outbreak, current outbreak, could spread, probably won't, but the next outbreak might if we don't get vaccinated. So please get vaccinated. We're approaching 80%. We're really nearly there for the territory, but beyond that, for these communities, I've really appealed to them to come forward.
And just, I guess again, but do we have an idea of how many people would be hospitalised a day under that current Doherty modelling when we were to kind of move forward down the road now?
So the numbers every day, I can't give you that number, but it's a small number and manageable within our resources.
Dr. Payne, Gerard Rennick, who's the Liberal Senator from Queensland, he said today people want to know that they're not going to get sicker from the vaccine than they might from the virus. Can you answer that question?
Well, yes. I suppose that's an important question, but it's so obvious and so clear that the vaccine itself, there's plenty of evidence now, with hundreds of millions of vaccine doses having been given around the world, that the vaccine itself, whichever vaccine you get, has a number of very rare side effects. For example, the one that people are concerned about with Pfizer, that's a 1 in 100,000 chance of getting the myocarditis. And no one has died of that. It's treatable and people recover from that. if you get the disease, you can see the numbers. We've got 4 patients in hospital. We've had a number of patients in hospital. So we are seeing it unfolding in front of us, how serious it can be. A number of those patients have had to be on oxygen, have been significantly ill. We've been able to give them maximal treatment in the territory, but that's clearly the comparison. It's no question that the comparison.
How disappointing is it that there are leaders out there, especially in our federal parliament, that are saying these sorts of things?
Well, I don't know I don't understand the motive. If they're concerned about their community and they're trying to protect them, you have to give them the benefit of the doubt that that's what their motive is. They clearly don't understand the evidence. And I just hope that it's not the motives are other than that. Obviously, the people who are working in this field and who are trying to protect the community are dismayed by those sorts of attitudes.
Can we get a condition update on those in hospital? You just mentioned there were 2 people on oxygen currently in RDH. Is that accurate?
Yes.
Okay, so the 65-year-old woman, she's gone back to oxygen?
No, she hasn't. She's actually, very pleasingly, she's recovering. I don't know when she'll be discharged, but she's on that pathway towards discharge, so that's very, very pleasing.
And the others, can we get a bit of an idea how they're doing?
Yes, so they're all requiring oxygen, but they're not critically ill. No, 2 of them. They're requiring oxygen, but they're not critically ill. They've got significant COVID disease. Obviously, they're short of breath and requiring oxygen.
Obviously, I'm assuming one's a 78-year-old woman, the other is either the health worker or the man who was one of the earlier cases in this cluster?
I've actually got the list here, but it's that the most recent cases are requiring oxygen and one of the other cases that was admitted.
Of the 40 cases in this cluster, how many of them are still active in terms of actively infected with COVID rather than recovered?
I don't have that number for the total outbreak.
Yeah, so you said earlier there were 40 cases of Ghana, so there were 40 cases
Yes.
overall from the Cairns woman all the way down the chain of transmission. How many of them are still infected with COVID?
We don't have that number yet, and that will take some time to evolve to demonstrate that, because we have to wait and see whether they've recovered at the end of the 14 days, whether they're negative at the end of that 14 days. Yeah.
We ask the Chief Minister. Chief, yesterday you said that anyone who is anti-mandate is an anti-vaxxer. The Prime Minister's been pretty clear that he is opposed to mandates. Do you consider the Prime Minister to be an anti-vaxxer?
I don't keep track of all federal parliamentary shenanigans, but I thought the government voted for the mandate yesterday in Parliament.
The government voted against the anti-mandate legislation, but the Prime Minister has been on the record several times since last Thursday saying that he opposes mandatory vaccination. He believes governments need to stay out of people's lives. So is he an anti-vaxxer?
Well, the Prime Minister can speak for himself, and all my conversations with the PM in talking about the territory situation and what we're doing here, I've only had anything but support from the Australian government.
Adil, maybe this is a question
Last
for
one.
Just, we've seen a big take-up in testing in Katherine. It's still not enough to catch community cases. Is there an ideal number of testing for daily basis for Katherine?
We've seen an excellent testing return from Katherine residents. I think a lot of them are making the effort to go out and get tested. What we've seen in some of the cases that we've had is that it's not necessarily the first test that will be the one that matters. It might be your second or third test. We've also had some people that haven't necessarily checked in at an exposure site for us to know they're a close contact, for us to tell them they're a close contact and let it turn positive. So one reason why checking in is really important. So unfortunately, I don't think I could say to you with confidence there's an ideal testing amount to guarantee no spread. There will come a point in time though where the back of 10% a day kind of testing results we're getting out of Katherine, we came with confidence with that kind of testing results, negative wastewaters, have a confident decision about lifting a lockdown or a lockout decision. But at the moment, when we're seeing a positive wastewater result out in the Katherine golf course area, persistent positive wastewater out in the bicentennial areas, until we see a break in that wastewater, we're probably not confident we've got all the cases, even with that testing results. But if we get a break of negative wastewater, which hopefully will be on Friday, so for bicentennial, for example, It will be Friday when we're confident I've got the cases out there if we're getting negative wastewater then. So if we've got negative wastewater on Friday from Bicentennial and we've had a lot of testing through that area, we might be confident about that Bicentennial area. So it's a combination of the two. That'd be a reasonable summary, I believe, Dr. Payne, of where we've gone.
What do we know about the people who aren't yet vaccinated in the Katherine area? Are they particular in a certain demographic in terms of age or gender or things like that?
Katherine is one of the harder areas to get a really good idea about the vax rate. So it's us, Worley, Katherine West and Sunrise doing vaccinations through there. We believe, looking at the data between all four of us, the vaccine rate for Katherine is 83% first dose, 77% second dose. We're fairly confident in those figures. So I think that's probably too larger amount of missing first dose, missing second dose, when we have our confidently say it's in this area or this demographic or that jurisdiction. We were doing door-to-door public housing vaccination efforts week before last, which we obviously have paused here. We're now looking at stepping back into the mobile vaccination path again. I think, as we've seen with the fairly consistent numbers through the vaccine hub, but low numbers for the vaccine hub, that we may have exhausted that kind of mobility turn-up vaccine effort. It might now be more that door-to-door approach that needs to be done for the vaccine in Katherine. So there might be some mobility issues, for example, some complacency issues that we need to tackle.
One question for the Police Commissioner, if that's possible.
In regards to the fatality on the Stewart Highway last night, can we expect charges to be laid?
It's too early to tell. Unfortunately, a very tragic incident. We've still got to review quite a lot of things to work out exactly what the causation was. It's not readily apparent.
Police Commissioner, we know about the threats that were made against the Chief Minister, but are police aware of threats that have been made against any other Northern Territory politicians? I know the AFP Commissioner saying on the weekend that they've seen an increase in that sort of behaviour.
Look, unfortunately, it's been a bit of a trend across the nation. We've certainly been actively monitoring that. A lot of the language, unfortunately, is pretty poor rhetoric, and unfortunately, it's directed and targeted. We do track what's localised and certainly what the commentary is coming from overseas. It might surprise a lot of people to know much of the commentary is not necessarily born in the jurisdiction that it's targeting the individual's residence. But the simple fact of the matter is that behaviour is pretty poor, pretty cowardly in my humble opinion, and it's not a case that people should be getting threatened for doing what their job is and acting in the best interest, particularly in the Northern Territory, is the case it presents here.
And will you take action against those who are caught doing that?
If we see any breaches of our legislation as it relates to criminality, we will absolutely take action.
The chemical substance that was thrown at police, we had it sent off to Victoria, I believe Melbourne, for testing. Are we any clearer on what that substance was?
So they have sent it for further forensic analysis. I'm still waiting on the update of that, but my understanding was the initial analysis required further assessment, and that's why it's been extended in the period of time. I don't have a time frame at this stage, unfortunately, Miles.
The Chief mentioned that Katherine was 77% double dose vaccinated. When Katherine reaches 80, does it transition automatically to a lockout, or is there some sort of arrangement that's been made about that?
Look, the harsh reality is we've got to play what's currently in front of us. What is concerning is that the wastewater stays persistent, and now with the golf course having come on board, what we are fairly comfortable about, though, is that the amount of testing that's coming through, people coming forward, the fact the lockdown is in place, hopefully by the time Katherine reaches 80%, we should be at least through this and having negative results across the whole of the wastewater. That's certainly what we're working towards. We'll have to address what that arrangement is in consultation with the CHO. It's ultimately the CHO's statutory determination to work out what's in the best interest of people in Katherine at the time. So that's where we'll go.